a very dangerous hamartoma, which one in the lung. This one can block on the bronchus and make an obstruction of the bronchus, and this one can lead to death. So, but in that case, you see the normal tissue of the lung, but clinically, it is a tumor. They say hamartoma have traditionally been considered developmental malformation, but some genetic studies have shown the presence of acquired translocation, suggesting of a neoplastic origin. For example, in the case of the lung, even in the breast, found some hamartoma. There's another term called Cholistoma. Cholistoma is a congenital anomaly consisting of heterotopic rest of cells. For example, the most common, you can find some pancreatic tissue in stomach, duodenum, and intestine. In that case, it is called cholistoma. You will see them in your practice, where you say you have a tumor in the stomach. On a microscope, you found that it is pancreatic islet in the stomach. So that heterotopic rest may be replaced with islet of Langerhans and the exocrine gland in the case of those pancreatic tissue in the stomach. There is what we call Mecinomas. Mecinomas, when you look at hepatoma, you can think hepatoma is a benign tumor. It is not true. Hepatoma is a malignant tumor of the liver. Melanoma, a malignant tumor of the skin. The cell involved here, they are melanocyte. A seminoma, a malignant tumor of testes. This one, it is involved in the seminiferous tubules. Lymphoma. Lymphoma, always you see lymphoma, it is a malignant. The cells involved are lymphocyte, either B or T. So this is why they call it melanoma, because they look on the writing, you can think it is benign, but it is malignant. This one, it is an opening teratoma of the ovary. You see here some hair follicles. On microscope, you see some sebaceous bones. This is a bone. And there, the sebaceous gland. And here, respiratory epithelium. So this one, it is a teratoma. So don't be surprised when on your report they found you submit an ovary in the lab, then the report will come. We found hair follicles in the ovary, found the bones. So this one, I say it is a teratoma. For example, this one is dermoid cyst of the ovary. It has a cystic lesion and some sebaceous gland here. This one, it is case of a malignant cells invading the stroma. This one, stroma is this one normal connective tissue. In those hyperchromatic dark blue, these are a malignant tissue. Adenocarcinoma of the breast. If you still remember the normal histology of the breast, you see here there are some irregular, discohesive, loss of polarity, hyperchromatic tissue invading the breast stroma. These are the malignant cells. So this one is the adenocarcinoma. This one is a blood vessel. So about the pathway of the malignant tumors, we have seen before through the lymphatic vessels, hematogenous spread. Through the lymph node, you see some metastasis in the lymph node. For example, you see a breast tumor, but on the axillary lymph node, we found some tissue from the breast to the lymph node. This one, they pass through the lymphatic spread and the hematogenous spread through the blood vessels. They say arterial spread may occur, however, when the tumor cells pass through the pulmonary capillary bed or pulmonary arteriovenous shunt, or when the pulmonary metastases themselves give rise to additional tumor emboli. Most of the time, metastases, they are found in the lung because of drainage of the blood in the lung. This is why the most common metastases are found in the pulmonary tissue. There is what we call seeding of body cavities or surfaces, spreading by seeding of body cavities. This one may occur whenever a malignant cell penetrates into a natural open field. For example, through the peritoneal cavity. Most of them involved in the peritoneal cavity, but in other cavity like pleural, pericardial, subarachnoidal, joint space may be affected. Such seeding is particularly characteristic of carcinoma arising in the ovari, and then through the peritoneal, they can reach to other site. For example, you can find a tumor of the stomach which metastases to the ovary. This one passes through the peritoneal fluid. They say remarkably, the tumor may remain confined to the surface of the coated viscera without penetrating into the substance. For example, some people, they say once you open a cancer, they say it can increase the rate of the cancer. This one, it is not totally true. Most of the time, it is very, very rare. Here they say, although direct transplantation of the tumor cells, as for example, on a surgical instrument, may theoretically occur, but it is rare. So, for the spread of the malignant cells, it is lymphatic route, hematogenous route, and body cavities like those peritoneal, pleural, and pericardial fluid. For example, here it is the lymph node. You see lymphoid tissue here. But here you see pleomorphic, looking like glandular pattern in the lymph node, like this one. So this one is metastasis adenocarcinoma in the lymph node. Here there is a fat around the lymph node. There is a lymphoid tissue. This one is the malignant cells from gland. By lymphatic route, it is now found in the lymph node. There is another term, before you go to the break, another term called dysplasia. Dysplasia literally means abnormal growth. It is a malignant transformation. Malignant transformation is a multi-step process. In the dysplasia, some, but not all, the features of malignant are present microscopically. Dysplasia may develop into malignance, meaning that dysplasia is benign, but may develop into malignance once there is no proper treatment. The most common are in uterine cervix and colon polyps. They are graded as low grade, intermediate, or high grade. Dysplasia may not develop into malignance. Dysplasia may develop into malignance. A high-grade dysplasia is known as carcinoma in situ. Carcinoma in situ is known as high-grade dysplasia. Dysplasia is benign because dysplasia, in that case, there is no invasion. The tumor is still on the epithelium. Look at on this image. You see here, this one is a normal epithelium of the cervix. But on this one, from here to here, it is hyperchromatic, dark blue. The cells are disorganized and not organized like it is here. They are dark. Some are large, others are small. So this one, it is a case of dysplasia. But when you go here in the upper, you see some small cells uniform. This one, it is normal. And this one doesn't breach the basement membrane of the epithelium. This one, it is in the cervical gland. It is normal gland. You see the cells preserve the polarity. They are on the same position. This is what we call polarity. And here there's mucin. So this one, it is a normal gland. This one is abnormal epithelium. For example, in dysplasia, this one, it is known as CIN1, CIN2, CIN3. Cervical intraepithelial neoplasia, 1, 2, 3. 1 is low grade, here it is intermediate grade, here it is a high grade. High grade is known as a carcinoma. For example, this one, it is a normal epithelium. You see here on the lower part, lower third, is hyperchromatic cells. And this one, upper, is normal. On this one, there is 2 intermediate, 2/3, there is abnormal cells. Whereas here, full layer of the epithelium, it has abnormal cells. This one, it is known as high-grade dysplasia. High-grade dysplasia known as carcinoma. And this one, when you see basement membrane here, even here, it is still intact. It is still intact. Once there is invasion, there will be breach of that basement membrane, and we see those malignant cells here in the stroma. In that case, it will be invasion. So before we go to the grade and staging, we can have a break, but I would like to know if there is any question about that dysplasia, metastasis, those nomenclature of the tumor. Any questions? Yes.
Number 36.
Sorry?
I'm asking about the slide number 36. I'm asking if is this an intermediate grade dysplasia?
Yeah, this can be an intermediate, very good, because it takes 2/3 of the epithelium.
Okay, thank you.
Yeah. See here the normal cells, and below there is the abnormal cells. And the reference is one normal epithelium. Any question?
Yes, lecturer. My question goes like, you talk about the cyst, and are they all the cyst tumor? Because we know, like, in Kinyarwanda, what we call udusunono, are they type of cysts or tumors?
You are going in confusion if you go in Kinyarwanda. A cyst is a tumor containing a fluid inside. It has a capsule. and inside there is a fluid. Those who call it Masunula, I don't know how is it in Kinyarwanda, because Kinyarwanda is not well developed in medicine. So you can see some papilloma on the skin. These are benign tumors of the squamous cells. Maybe those what we call Amasunun, maybe they are called a papilloma. Okay.
I have a question.
Mm-hmm.
On slide 32.
Sorry?
Slide 32. Why is pulmonary bed the only mean of
Speak aloud.
32? Why is pulmonary capillary bed the only mean of transport?
Sorry?
Why is capillary beds the only mean of transport? Beds don't do that. Cells can other capillaries and into the artery.
I don't know if there is a problem of internet connection, but don't understand clearly the question.
I was asking, is the pulmonary capillary bed the only mean of transport? The pulmonary capillary bed. Other capillary beds don't, the tumor cells cannot pass through other capillary beds and go through arteries.
This one, it is a question of the anatomy and the physiology. So the spread of those tumor, it is through the hematogenous route, meaning that it is blood. It can be even in the artery or in the vein. It doesn't mean it is only via the artery, even in the vein. Here they say arteries with their thicker walls are less readily penetrated than are veins, meaning that hematogenous route, it is for every blood vessel. Okay? It is not only pulmonary capillary bed only. But what you know with your physiology and the anatomy, you know the blood gas exchange in the alveolus. This is why there is more metastasis in the pulmonary tissue. So the malignant cells go together with in the blood, and most of them they reach the lung because of that physiology of blood gas exchange. Okay?
Okay, but I have another question. What is the difference between neoplasia and dysplasia? Both mean abnormal growth.
Neoplasia and dysplasia.
Yes.
Neoplasia is abnormal cell growth. It can be either benign or malignant, meaning that dysplasia is a kind of neoplasm. Dysplasia is neoplasm which is benign and which may develop into malignant neoplasm in case there is a proper treatment. Okay? Okay?
Yes, thank you.
Okay.
Okay. Another question before break?
Question, teacher.
Yes.
I would like to know the difference between a tumor and a carcinoma.
What is a carcinoma? Even your colleague can answer. What is a carcinoma? A carcinoma is a malignant tumor of what? Of epithelial tissue. Okay?
Yes.
So, as an assignment, you will write a long list of benign and malignant tumor. Okay?
Excuse me, sir. Can you please repeat?
You will write a list of benign tumors and malignant tumor. For example, if you write a fibroma, a benign tumor, a fibrosarcoma, malignant tumor, chondroma, then chondrosarcoma, adenoma, adenocarcinoma, you go like that. Because what you have seen here, it is not exhaustive. There is a long list of a benign and a malignant tumor. This one you have to write it as an assignment. Okay?
Thank you.
So you write on the character of benign and malignant tumors. I think this one is an assignment number 2. Okay? Okay, can we have a break of 15 minutes?
Yes.